Hello, I'm Claire.
And I'm Lizzie, and we're pelvic health physiotherapists.
So in this session we are going to cover various aspects of everyday activities.
So Claire, now we're going to have a think about our everyday activities and how we can tweak these and how we can modify these. And a really big part of this is pacing. Throughout our lives we have busy days and often we have a lot of pressure on ourselves either through work or through things we might need to get done at home or from looking after children. We want to think about how we can break up those activities and how we can break up static postures to help us to manage our pain. So if you have a job where you're on your feet for prolonged periods of time, or if you are doing housework such as tidying or clearing up, rather than spending an hour on your feet, see if it's possible to spend less time, and after 20 or 30 minutes, can you have a sit down, can you have a lean against the wall, even if it's just for a few minutes, to change that posture, change that position, which will then help you ease and manage your pain. On the same side of things, if you have a job where you're sitting for prolonged periods of time, do remember to get up and change your position every 20 minutes. Always remember your best posture is your next posture, and your body is always happiest when you're changing your position little and often. Now let's have a think about housework. So in terms of housework, what we'd often recommend is if there's anything you can avoid doing, avoid it. If somebody else can hoover, let them. If somebody else can pick up an object that's been dropped on the floor, such as some toys or some clothes, do let them do this. It's better if you can avoid repeatedly getting on and off the floor many times during the day. At the start of the day, see if you can bring everything down with you from upstairs to minimise how many times you're going upstairs and downstairs throughout the day. However, when you are going up and downstairs, what we would recommend is that you lead up going with your least painful leg, and when you're coming down the stairs, you walk down leading with your more painful leg. So your stronger leg is going up, and your more painful leg is going down. Some ladies also find it helpful to walk up the stairs sideways, a little bit like a crab, and this can give some relief as well. Now we're going to have a think about now how we might bend and pick things up off the floor, because sometimes we might have to pick up children and there might be nobody else there who can pick anything up. So let's have a stand up there. So, as we said before, we want to avoid positions of strain in the pelvis. So what we do want to avoid is squatting with our knees wide apart, because we feel we have to keep our back very straight, because this will cause a lot of pressure on the pubic bone and will increase your pain there. So we're going to come back up, Claire. And what we recommend that you do instead is that you take a step forward, that you relax the shoulders, and as you come forward, scoop and bend and lift and pick up the object. Let's watch Claire do this now. We're going to take a step forward, Claire. We're going to bend the knees, scoop forward, and up we come, bringing the object close to you. Well done. Okay, let's put this back down in the opposite fashion. There we go. So the more you can avoid repetitive bending and lifting, the better, but that's a good way to try, an optimum way to try to see if it will minimise your pain and discomfort. So overall, we want to reiterate the message to change your position little and often. We want to minimise how long we're staying in prolonged static postures, and if you can avoid excessive housework, this is good, and if you can't, try and pace your activities little and often and have little rests. Everybody will have good days and some people will have bad days, okay? But the more you can help manage and the more you can help to tweak all these little activities, the more good days that you will have.
So what we have to consider in pregnancy is to maintain our levels of fitness and activities. Although you may be struggling with pelvic girdle pain, hopefully you've learnt many different ways to manage pain. And what's so important to consider is that you may have come into your pregnancy being very fit and active. However, you've spent maybe the first 12, 16 weeks feeling very sick and may have experienced extreme fatigue. So your general fitness level would have come from a high level and dropped down suddenly. So this will lead to lots of deconditioning of the muscles and actually getting more stiffness in the joints. So what's really important is to know what you can do to keep active. We have gone through in a separate section specific pregnancy gym ball exercises, but we can do other activities. So to go out and to do some short walks, and maybe considering the hills in Sheffield, you choose somewhere flat rather than hilly. You can go out and then pace your walks. So it may be that you go out for a 10-minute walk and you need to be doing enough of a walk to become moderately short of breath, but you can still hold a conversation. Other forms of activity may include swimming, pregnancy yoga or Pilates, or it may be that you just play throw and catching the ball with your children, and you may well be able to continue some light gym activities. So what we really want to do is to make sure through the pregnancy we try and keep our bodies as fit and as healthy as we can. Also, the physical activity is so important for our mental well-being as well. And having a nice strong body in pregnancy will lead us through the pregnancy and to prepare us for birth. And I think having that fitness for birth will then stand us in a really good position for a good recovery after birth and in the months that follow. You may want to take a look at 2019 government guidelines on physical activity for pregnant women.